We've been telling you for several days now that cases are ticking up. We've just learned rural areas of our state are seeing an alarming rise in infections, and it's mostly affecting minority communities. Christy Diaz sat in on a call with two renowned epidemiologists to get the latest.
So it turns out who this virus is affecting is changing. At the beginning, we were most worried about the elderly, but now Dr. Carlos Del Rio and Dr. Jody Guest say the people it's affecting the most right now are people ages 20 to 50 in the Latino and African American communities.
Yes, the highest numbers are still coming out of Metro Atlanta, but that's because it's a very densely populated area. When you look at the percentages related to population, that's where we see the trouble in rural areas. They say it's important to realize there are several different outbreaks going on right now. Dr. Jody Guest has been working in Hall County. She says the Northeast Georgia outbreak is centered in the Latino population, specifically around the poultry plants. She reports about 25% are testing positive.
Communities in Northeast Georgia and the Latino population tend to be multi-generational, multi-family in single-family homes. So they're working in a crowded condition, and then they're going home and living in crowded conditions as well.
In Middle Georgia, the outbreak is centered around the African American population. And in South Central Georgia, they say it's the Latino agricultural and migrant workers who have to live in barracks and don't have the opportunity to socially distance.
We are beginning to see, however, a dramatic shift in the demographics of the epidemic. COVID, I think, is the ultimate example of a disease where we're seeing health inequities and health disparities really come up.
So they admit it is hard to find good solutions to some of these problems, but they are working on it. And they want people to be aware that COVID is still here. It hasn't gone anywhere and likely won't for a while. So instead of wishing for normal to come back, they say it's time to adapt to a new normal with masks, face shields, and extra space.